Good evening. It is Thursday, September 28th. This is the North Andover Board of Health. I officially call this meeting to order. We'll start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next item on the agenda is the approval of meeting minutes for our May 25th and June 22nd, 2023.
I did review both of these minutes. I believe we did have a couple of corrections, but they were made. So I make a motion to accept the May 25th minutes and the June 22nd minutes.
I will second that motion.
All in favor?
Aye.
Meeting minutes for May 25th and June 22nd approved. Moving on to the next agenda item, which is old business. We'll start with grant updates.
Okay, I'm gonna add something in there. I completely forgot, but I'd like to welcome Shanine Pierce to the North Andover Health Department.
Welcome.
She
Welcome.
is our new inspector. She's been with us for a few months now, but we haven't had a meeting in a long time. So here she is, and I'm gonna put her on the spot and say, welcome. And want to tell the board about yourself for about a minute.
Yeah, so I've been a health inspector since 2017. Most recently, I worked for the Massachusetts Department of Public Health Community Sanitation Program. I grew up in the Merrimack Valley area, so I'm very familiar with all the surrounding communities and the work that's been done in the public health field. So it's exciting to be back home. It's nice. We've had a very busy summer so far with flooding and power outages. So our department has been busy, but we're pretty much up to speed and going into the fall, you know, head first and ready to tackle everything that comes our way. So,
Welcome.
thank you.
Thank you. Glad I get to put you on the spot once at least. All right, on to grant updates. So as you know, we have been participating in two separate grants. The first grant that I'll discuss, Michelle actually helped out with, and Brawl helped out with a little bit as well. That is the Community Health Improvement Plan. That started over a year ago with funding we got from ARPA and the state, and partnered up with Andover to pool our resources and perform a community health improvement plan, which literally dates back to over a year. That included focus groups, written surveys, online surveys, interviews with residents and people around town, different department heads, different departments in town, and compiling the information, going through it, and using an advisory group that Michelle was part of to formulate an improvement plan for the town of North Andover. We have our CHIP. It's in a final draft form right now. I'm in the process of reviewing and finalizing it. It's 53 pages right now and needs some final edits, some additional details, and some minor tweaks and changes. But essentially, it's pretty much done. So the general overview of the CHIP is we did the focus groups and did all of the data collection and came up with three priorities that were across the board. Number one was mental health across the lifespan. That is a giant scope because there are so many things involved with it. Because when you talk about mental and behavioral health, you're talking about youth, adolescents, and seniors. So all of those were very high priorities. So we lumped them all together and did mental health across the lifespan. And that also includes substance abuse, because that is that's an effect of mental or behavioral health issues that coincide with substance abuse. So that's number one. Number two is affordable housing. That goes across the entire town, from seniors trying to stay in their homes, or trying to move back closer to their kids and grandkids, or families trying to start out and buy a starter home. As you know, there aren't very many starter homes in this community, or very many low-priced houses that people can buy. Land is expensive, houses are expensive, so this is a major focus across all the age groups. And it's a great town to raise your family, and so people want to move here with their families and good school systems, things like that. So that was number two. And number three was diversity, equity, and sense of community. That goes across all of the DEI things that are being talked about now for all of the different groups in town that may not feel represented, or people that just don't feel in general that there's a sense of community. We want to bring those people in and have them be part of the town and part of the community and part of the local networking groups that we all belong to, whether it's the sports leagues and having kids in town, PTOs, things like that. I think is one of the things that people wanted to focus on as well. So that's the third priority. Each priority has goals, objectives, and draft strategies for each objective, and then outcome indicators to monitor over the next several years. So that's something that we're going to start working on once this is finalized, and I'll give you guys final copies, hopefully for the next meeting, and we can start discussing it and start going through the different strategies that we came up with. We've also got listed out potential partners and resources to help with each one of those strategies. So it's kind of lengthy. This is the draft right here. It's 53 pages. And for instance, for each priority, 1, 2, and 3, we've got multiple objectives for each one. So for example, mental health across the lifespan has 4 different objectives. You break that down further, and each objective has, let's see, let me find the first one. So objective 1 in the mental health strategy has 4 different tasks associated with that strategy. So it kind of balloons out as you get into each one of these. So there's a lot of work to do. We're going to start tackling it in the very near future, and hopefully move this along and bring in our stakeholders and partners and start working on some of these things for the town. So that's that grant in a nutshell. The next one is the Public Health Excellence Grant. We partnered with 5 other communities in the area and received money from the state to do a shared services group. So to expand and increase our capacity as public health professionals, bring in regional staff to help us, each town in the collaborative, to do more resources, more things can get accomplished. So we're in the process right now of starting up year number 2. We got the grant. We worked with the different communities to come up with and draft an intermunicipal agreement, and then hiring shared staff. As of right now, we hired a shared services coordinator. Her name's Annette. I'll ask her to come to the next meeting to talk a little bit more about the grant. So once we got her on board, and we all advertised, selected, job offer, hired, on board. She works downstairs in community development with us now, and is working on hiring a public health inspector to be shared by the region, and a public health nurse. We do have an offer out, or are preparing an offer right now for a regional inspector, and we are re-advertising for a regional public health nurse. The first advertisement that we put out there, we got some nibbles, but nothing has come to fruition, and we're going to re-advertise and hopefully get in more candidates to move that process along. Let's see. So year 2 funds are on their way. We've been waiting. They were supposed to come here over a month ago. So we're in a holding pattern right now, waiting for the new funds to come in. And they did increase our allotment for the communities up to, it's a little over $500,000 now. So it went from $300,000 to $500,000 in a year. So we can do a lot more with that. We can bring in the staff, do more trainings, programs, trying to do some standardization for inspections, get some inspection software to be shared across the region. So that's underway right now. And our work plan and budget has been approved. The money has been at least allotted to us. We're just waiting for it. The state says hurry up and wait. We want all your stuff now, and then we'll tell you eventually when you get money. So that's where we are right now. And that is my grant update for today.
Any questions on any of that?
Next, we have Petco.
Okay. Are you guys familiar with what's been going on there for the past year? We may have given you some brief updates over the past.
I'll say vaguely.
This has been finally taken care of. We have worked with Petco and their pest company. The last letter is the one that went out last month. We did work with them. We removed all of the food sources located in the store. They took the store apart. They cleaned. They eradicated the infestation. They are And as of last Friday, they get the green light to bring food back in and reopen. So this has been a long process. Literally, it started over a year ago. But it was a never-ending battle because it got to a certain point where the bait wasn't working, the traps weren't working, the store's too big, the population was too big, and they had too much food. They had obviously bags and bags of food everywhere. So this has finally been taken care of. The landlord also got involved. I haven't spoken with him directly yet, but he did give them some construction crews to help seal up the outside of the building to eliminate any type of entrance of any more rodents coming in. So we made it, finally. So they should be, I don't know if they reopened yet, but I gave them the green light last Friday to start bringing stuff in, start putting the store back together, and then reopening to the public. So their employees and their staff are extremely happy, and I'm sure the residents in the area that rely on Petco for their pet food will also be very happy. And that is my Petco update.
Were they kind of just doing like the abatement stuff initially, kind of like, not really, I want to use other words, but
Yes,
like, okay.
absolutely 100%. So I have had meetings with the regional managers of Ecolab and Petco. They brought in their district and regional managers. I sat down with them last Friday. We went over their IPM, their integrated pest management plan, specifically line by line and where the failures were. I was obviously not very happy, but I was cordial and nice and got my point across that this is never going to happen again. And they're all on board. And they turn over, people changing positions, things fall through the cracks, the whole gamut of everything going on. But the people that are there now are supposed to be staying for a while. The store managers have their marching orders. They know what's going on. They have my direct contact information now. So this supposedly will never happen again. And I think with the work done to the building itself, the physical structure will also help alleviate this a lot, because it's New England, there are field mice everywhere. In the winter they come and they look for food. When you have a buffet, they're gonna stay.
Was there any impact to Walgreens next door, or no, or did they stay to the one part of the building?
Most of the food was at Petco.
Okay.
The landlord has been working with Walgreens on doing their side of the building as well. But with the amount of food in Petco, it's a pet store with pet food.
Right, they didn't
Like,
have to go next door.
Aisles and aisles and aisles.
It's a whole buffet.
Right. They didn't have to go for the shaving cream next door at Walgreens.
Well, they have food at Walgreens.
Yeah. Candy.
They do, yes.
Chips.
But yeah, so Walgreens did have a little effect as well, but I think with the food being removed and the baiting for over a month with no food source has eliminated or completely reduced the population to a typical level in this area.
Okay. Any other discussion or questions on Petco? Next is COVID-19 vaccine and influenza vaccine clinics.
So we are starting our flu clinics every Wednesday from 9:30 to 11:30. We are hosting a flu clinic at the new senior center. Our big family flu clinic is October 24th. We extended the hours a little bit from it's 4 to 7 now. For COVID vaccines, we are trying to get Greater Lawrence to host a booster vaccine, but their shipment is delayed. There's just like a delay everywhere with the COVID vaccine. People are telling me like the CVS ran out already. So we are hoping for an early November date for the monovalent booster vaccine. And then hopefully later on in the winter, we're trying to do a shingles and an RSV clinic as well.
Awesome.
That's great.
But no dates on those yet.
Also late November.
Okay.
That's what they gave me.
Locations for those?
We are going to try the new senior center just because it's very fancy and nice there. And Kathy's happy to have us there.
Good.
Great.
And the family food clinic is at the high school?
It is at the high school, as usual.
Cafeteria?
Cafeteria.
All right, good. That actually worked out really well for us. They have, all the tables are right there, so we don't have to set up folding tables, and the chairs are all right there, so we don't have to bring chairs in. So, and we don't kick out any of the sports teams trying to practice in the winter, because we always get grief for that.
I saw that this already got distributed. I got it through email,
Yeah, I
so
got
too,
the email,
yeah.
yeah.
Although
Okay.
people were already asking, so that's good. People are like, are they
Oh,
doing
yeah.
a clinic? So I think people are starting to get in the like habit of looking for the clinic every year, which
Yes,
is great.
and the family flu clinic is ages,
3 and up.
yep. So I know, a lot of my son's friends always go, and parents have to hold them down.
Well, Tony always has the best treats there, so.
Yep.
Anything else on that topic from anyone? Okay, file for life.
Should I put Tony on the spot for this one?
Yeah, but she's gotta get in the camera.
Oh, no? I put these in your or Tony put these in your packets. This was her baby. We talked about it. She was very excited about it. She worked with the company that does these. She helped design them, and she helped order them. And we have them. We got, what, 500? Yep, so we got 500 of these. Now that we have them, we're gonna bring them to the senior center, and we're gonna distribute them through the health department. You guys know what this is. It's a magnet that goes in your fridge. It's got your medical information. If you ever have to call 911, this has all the bullet points that they need, or that they want to know about what medications you're on, what conditions you have, things like that. So this is just for you to give them the information they need if you're having an emergency, and maybe you can't speak, if you're having any type of serious medical issue. This will just help. And it's right there in the fridge in bright red. They can see it and they can grab it, or you can point to it. So, just a little something we had that we wanted to get out there into the community.
You can give them out at all the clinics every Wednesday.
This is great.
Yeah.
We started.
Did you?
People
Yep.
take them. I don't know if they're pulling them out and putting them up, but they take them.
If people want them and they take them, I hope they use them.
Right.
They're not hard to fill out. It's just your medical information that may come in handy.
I know this sounds weird, but is it possible to almost like scan a template of this and keep it on our website so that if people want to
It's a great
type
idea.
one, print it out, like to just have it on there as like
Yes.
an editable?
Mhm. That's
Because
awesome.
then we could also say, put like to get a, that way we can encourage people updating their medications and
And if
everything.
people want to download a new one,
Right.
or print out
right,
a new one,
Right.
They
Because
can
this
revise
will
their
stay- I
information.
was gonna say, this is the most
Yes.
important thing. They can then refill the.
Correct.
Yeah. I like the DNR or most form.
Yeah, I do too, yeah.
Yes, that's
Yeah.
definitely key.
Somebody up here mentioned that.
Yes. mhm.
And
And
did,
healthcare proxy, that was the one I mentioned. And most, too.
Yep.
and do all the EMS providers know about these so they can start looking for them? Or even giving them out?
You know what, we might actually have to give some to the fire department.
Because
I
they
think that's a great idea.
Yeah, because
Yeah.
they could give them out too.
Okay.
So- And I would definitely get them to all the senior housing and assisted living
We're
and
gonna have to
stuff
order
in
more.
town.
But we have funding to get more. This was just the initial batch to
Nice, no, it's awesome,
kind of test it out.
yeah?
Does the fire department do lock boxes for like the elderly, senior housing?
Yeah.
I knew like a couple of the fire departments in the area did that. It's like they provide like a little box that the homeowner can put a key in there, the fire department can access, so if they've fallen and they can't get up, the
Okay.
fire department doesn't have to break down the door.
I don't know if they do it for individuals, they do it for like the housing complexes, is that what you meant?
Okay, but yeah, I know like Danvers,
Like
I think, does it
individuals,
for
oh,
individuals.
oh, wow, I don't know if I've seen it on the individual,
I haven't heard that yet.
yeah.
But for individuals living in single-family homes,
Yeah,
And
so
that
like
way they're-
elderly, if fallen, so they don't have to break down the door.
I was just saying, because the
Right.
protocol is to
Break down the door.
break down the
Yeah.
door.
all
Or break, sometimes they'll go through the air conditioning.
Oh, I think that's good.
In the
right.
summer.
All right.
That's great, great job, Tony.
Yep.
Okay, we're moving on to communications, announcements, and discussions. Mosquito update.
This is just a brief little update. I know you guys saw the announcement we made this past week. We've had positive West Nile mosquito pools in Andover, Lawrence, and Haverhill over the past few weeks. We have not had a positive pool, but it's in the area. It's that time of year. Usually Triple E is coming around this time of year as well. Luckily, we're at the end of the season. It's getting colder at night. Mosquito activity is definitely way down because of the temperatures, which is great. But we want to get, it's in the area. Mosquitoes are still active. If you're going hiking right now and you're in a shaded area in the woods, mosquitoes are still active and they can still sense your CO2 and they can track you down. But their major hours, dawn and dusk, it's cold, so they're not out there as active. So I just wanted to give people the heads up. Still take precautions. West Nile virus is in the area. We have detected it. It's not in town, but it's not to say there's no risk. It's a moderate risk according to DPH mosquito control for this area. So that is our mosquito update. They are ceasing with testing because the numbers have dropped off dramatically, which is good. So I think this is the last week. Yeah. So I think yesterday was the last day of testing. So if I don't get a call tomorrow, we're in the clear.
Any questions about mosquitoes? Okay, housing updates.
Okay, so since I started working in this department, I've been assigned at least 12 housing cases, which is a decent amount for any one inspector. A lot of our housing cases, you know, they're more general issues within the units. We've had some dealing with water damage, pest issues, mice, very seasonal sort of situations. We did have a lot of occupants and even property owners calling because of the flooding that we've had in August. It's affected a lot of units, and because it's so widespread, companies are busy, people can't get out to handle the situation, so we get those phone calls. So not only are we doing inspections, but we are spending a lot of time, you know, discussing occupants' options and giving them resources on how to handle the situation. We do have, or at least I'm working with at least 2 active hoarding cases in the community. Hoarding cases are quite complex. They do involve a lot, you know, of time from the department. We are working with North Andover's social workers, which is a great resource that we have that not a lot of communities have, so we're very lucky for that. You know, we have been progressing in those cases, and one has been involved with the Northeast Housing Court and the property owner, so we are still working with them. But again, very complex, weekly visits, you know, very time consuming. But we have been working with occupants and property owners on those issues. So it's been a busy summer for housing.
We did have one housing case that appealed their order letter. Not a hoarder, but somebody in town that was having issues with their landlord. The landlord appealed it. They have since backed out, thank God.
Okay.
So we're supposed to have a public hearing tonight, but they withdrew.
Okay.
So that was kind of a nice little treat. So yeah, so Shanine inherited a lot of hoarding cases and a lot of housing cases, but she's been working very diligently and tackling them like a pro. So, well done.
Anything else on housing update? Nope. Okay, last one on our agenda is October meeting date change. And then I would assume any other updates.
I know, right? So the meeting happens to fall during our annual conference in Falmouth, so we're not going to be here. You're more than welcome to have a meeting without us.
Would be any fun.
Good point. So we do have a meeting scheduled for November 16th prior to Thanksgiving, because the meeting would actually fall on Thanksgiving. So the options are just keep the November meeting the 16th, move it closer to the November, whatever the,
Second. So
Yes.
2nd, 9th, or 16th.
yeah. So the 2nd or the 9th. So have one meeting for the 2 months, or just keep the then we're meeting as is. Completely up to you guys. I just wanted to throw out some options.
Well, the 2nd is the day of the dead, so I don't know if I can make it that day. I'm just looking at the calendar, so.
Okay, then.
I don't know why it comes up on my calendar. I mean, is there really a reason that we would need to move it?
No, but I just want to throw the option out there. Since we're not going
wanted to move
to
it.
be here for October. I don't know if we want to go that long without another meeting.
I'm just leaving the 16th.
Okay.
Okay. 16th it is, so we
Then
will
keep it on the
just
16th.
cancel the October meeting
Okay.
and just keep a November meeting. And if anything changes that is time sensitive, we'll adjust. Does that work?
If we have to call an emergency meeting, we can do that. But as of right now,
Right.
we'll keep it at the 16th.
Okay,
And you all have it on your calendars.
we will.
Yep.
Awesome.
Any other updates or announcements or just
No,
updates? Okay.
just, it's been extremely busy this past summer. We did just re-sign a contract with our septic consultant, Mill River Consulting, Mill River Engineering out of Gloucester. Dan has been with us since 2000. So we got a little lapse in the contract, so I've been filling in and doing as much septic as possible for the last 2 months. So I can't wait to get him back on board. And we do have a new food consultant. Mogen Solutions started with us, 2 months ago? So they're a fantastic company. I've known Maureen for literally 20 years. Our old food consultant, Sweet Safe, they had some staff turnover and they couldn't keep up with the demand of our inspections for the food. And with the amount that we have, the two of us can't handle all that on our own, so we bring in them. So we had a little backlog. Mogen's come in, stepped in, and has been helping us out get caught up to speed. And their contract is up the end of December. So they're basically finishing out this year, and then we'll re-sign them again and keep them on board. Any other food updates you can think of? Harrison's voluntarily closed. They're changing ownership, so it was in the paper today. Yep, absolutely. We were out there with the new owner on Wednesday. You guys know Dean?
I know the name.
He's from the area.
Yeah.
He's from Andover. He is got the bull by the horns, and he's taking this thing on. And they're renovating. They're gonna fix the building, fix the interior, fix the kitchen, bring in some new equipment, redo the menu. They are gonna have a lot of the same stuff that they have already, and then reopen. And he said hopefully about a month.
Wow.
That's quick.
So yeah, but that's been a staple and an icon in this town
It really is.
for my entire life.
Yeah.
So.
Is
kinda
it
happy.
reopening in a different name or different?
Yes,
No? Oh, it is.
Patrick's North Shore Eatery. So, I think you like that.
I'm funding it.
Is that a conflict of interest? No.
Yep, so that is well underway. Jamie's is in the process of rebuilding. I did meet with him about 2 weeks ago out on site, doing a couple minor layout changes inside. They are bringing their basement storage and refrigeration upstairs. So hopefully this never happens again and he doesn't have to go through this. I did get a call from a couple of guys looking to open where the Dunkin' Donuts is downtown on Main Street, right across from here. I think they're in the process of signing something with the owner to, it's gonna be barbecue. So, we'll see what happens with that.
On that one too.
Yeah. So things are moving, things are happening.
That's good to hear.
Yeah. So if I hear of anything else, I will let you know, but as of now, those are the two new things that we're talking about in terms of food.
That's great. Well, before I take a motion to adjourn, just wanted to thank you guys because I feel like you finally kind of were coming down from COVID and then we've had flooding and awful weather and all sorts of inspections. So thank you for all you do and hopefully at some point you can take a breath.
We're working on that.
Okay. Anything else
for this evening? Okay.
I'll put a motion in to adjourn.
I'll second.
All those in favor?
Aye.
Okay, meeting is officially adjourned.
Thank you.